Hello, everyone. My name is Caprice Lord, and I'm a phlebotomy student of the Qualitas Training Institute. And my lecturer's name is Miss Yvette Irvin, and this is my final video. What is phlebotomy? Phlebotomy is the process of making an incision into the vein for the purpose of drawing blood for medical and clinical testing, research donation, or transfusion. This process is also called venipuncture, and it can also be collected by using finger sticks from adults and heel sticks from infants. Roles of a phlebotomist: prepare patient for collection procedure associated with laboratory samples, maintain patient confidentiality, collect routine skin punctures and venous specimen for testing as required, comply with all procedure instituted with the procedural manual, prepare specimen for transport to ensure stability of sample, maintain safe working conditions. The purpose of this video is to outline and or describe aspects that are pertinent to the optimum functioning of a phlebotomist in delivering quality patient care, as well as to establish procedures performed by a phlebotomist routinely. Equipments used by a phlebotomist: gloves, masks, gowns or lab coats, hair nets, watches, pens, 70% isopropanol alcohol, gauze, cotton balls, tourniquet, bandages, needles such as the syringe, the butterfly, and the ETS, which is the evacuated tube system, lancelets, the vacutainer tubes, biohazard bags and containers, and sharp containers. Puncture sites. The process of phlebotomy is usually done on the arm, also called the antecubital fossa. The antecubital fossa is the shallow depression in the arm that is anterior, meaning in front of and below the bend of the elbow. This area is where the major veins for venipuncture are located. These veins are called antecubital veins because they are located on the surface of the arm, and they are also called the major superficial veins. There are three major veins found in the antecubital fossa. These are the median cubital vein, which is located in the center of the antecubital area. This is known as the first choice vein because it is larger and closer to the surface, and it is easier to anchor. Secondly, we have the cephalic vein, which is located in the lateral, meaning towards the side of the antecubital area. This is the second choice for venipuncture. This vein is much harder to palpate than the median cubital vein, and it is decently anchored. It is also said to be the only vein that can be felt in obese patients. Lastly, we have the basalic vein, which is found on the inner side of the antecubital area, and it is the last choice for venipuncture. It is also easy to palpate, but it is not very well anchored, and it rolls easily, and this may increase the risk for puncturing the vein or damaging a major nerve. Veins on the dorsal area, meaning the back of the hand, can also be used for venipunctures. Needle and needle gauges. The different needle gauges are 15 to 17. These needle types are attached to collecting bags. These are used basically for blood donation and therapeutic phlebotomy. Second, the 18 gauge. These needles are also known as the hypodermic needles. They are used primarily as a transfer needle rather than blood collection. The 20 gauge needle, also known as the multi-sample hypodermic needle. These are used when large volume tubes are collected. These are used on patients with normal size veins. The 1 gauge needle. This is also known as the multi-sample hypodermic needle, but the use is different from the previous hypodermic needles. This is considered the standard venipuncture needle used for routine venipuncture on patients with normal veins or for blood collection. The 22 gauge is also known as the multi-sample hypodermic needle. This is used on older children and adults with small veins or difficult veins. And lastly, we have the 23 gauge. This is known as the butterfly needle, and it is used for veins on infants and children and adults with difficult veins. So this is the components of the ETS, which is the evacuated tube system. We have the multi-sample needle here. This compartment here is the needle. This is where the needle is located. This is the bevel of the needle. This is the shaft. At the bottom here, we have the rubber sleeve, and this has a needle under it. This is what you attach the rubber sleeve and the threaded hub. This is what you attach this multi-sample needle to the tube holder. You screw that in, and then at the bottom here, the needle being covered with the sheet is what we push the tube into, and this is comprised of the ETS tubing system. The types of vacutainer tubes, the additives, the function of the additives, and the department that it is found in. First, we have the yellow top tube that has the SPS, meaning the sodium polyethanol sulfate, and the function of that is used as an anticoagulant, and it is found in the microbiology department. Second, we have the blue top tube that has the sodium citrate additive. The function of that additive is to prevent blood from clotting by binding calcium, and it is found in the coagulation department. Third, we have the red topper tube that has no additive, and it is found in the blood bank department. Then we have the gold top tube that has the clot activator additive, and the function of that additive is to promote blood clotting with glass or silica particles. Gel separates serum from cells, and that is found in the chemistry department. Then we have the green topper tube that contains heparin additive, and the function of the heparin additive, it prevents clotting by inhibiting thrombin and thromboplastin, and it is found in the chemistry department. We have the lavender top tube, or the purple top tube as we would call it, and that has the EDTA additive. The function of the EDTA prevents clotting by binding calcium, and that is found in the hematology department. Then we have the pink topper tube. This also contains EDTA, and the function of that also, it prevents clotting by binding calcium, and this is found in the blood bank department. And we have the gray topper tube. This contains the sodium fluoride and the potassium oxalate additive, and the function of that is to inhibit glycosis, and oxalate prevents clotting by precipitating the calcium. And this topper tube is found in the chemistry department. Order of draw for venipuncture procedure. Coagulation tubes, light blue. Serum tubes without clot activator, red. Serum tubes with clot activator, gold. Heparin tubes, green. EDTA tubes, pink and lavender or purple, and gray tubes, oxalate fluoride. Order of draw for capillary puncture. Blood gas specimen, CBGS, EDTA specimens, other additive tubes, non-additive tubes, filter paper for DBS collection. DBS also known as deep brain stimulation. Components of a phlebotomy tray: alcohol swab, gauze, assorted evacuated tubes, syringes, syringe transfer device, butterfly collection set, micro collection equipment, tourniquet, disposal gloves, sharps container, pen, and watch. Steps to follow for routine ETS procedures or evacuated tube system procedure. Review and accession test requests. Approach, identify, and prepare patient. Verify diet restrictions and latex sensitivity. Sanitize hand. Position patient. Apply tourniquet and ask patient to make a fist. Select the vein, release the tourniquet, and ask patient to open the fist. Clean and air dry the site. Prepare equipment and put on gloves. Reapply the tourniquet, uncap and insert needle. Ask patient to remake the fist, anchor and insert the needle. Anchor the vein and insert the needle. Establish blood flow. Release tourniquet and ask patient to open fist. Fill, remove, and mix tubes in order of draw. Place gauze, remove needle, activate the safety feature, and apply pressure. Discard the collection unit, label tubes, observe special handling instructions, check patient's arm, and apply bandage. Dispose of used and contaminated materials, tank patient, remove gloves and sanitize hands, and transport specimen to the lab. Venipuncture procedure of hand vein with the use of a butterfly and ETS holder. Review and accession test requests. Approach, identify, and prepare patient. Verify diet restrictions and latex sensitivity. Sanitize your hands. Position patient hand, apply tourniquet, and ask patient to make a fist. Select vein, release the tourniquet, ask patient to relax hand. Clean and air dry the site. Prepare your equipment and put on your gloves. Reapply the tourniquet, uncap and insert the needle. Anchor vein and insert the needle. Establish blood flow and release the tourniquet. Fill, remove, and mix tubes in order of draw. Place gauze, remove needle, activate safety device, and apply pressure. Discard collection unit. Label your tubes. Observe special handling instructions. Check patient's arm to see if it stopped bleeding and apply bandage. Dispose of used and contaminated materials. Tank the patient, remove gloves, and sanitize your hands. Transport specimen to the laboratory. Procedure of needle and syringe venipuncture. First, you review an accession test request, approach and identify, and prepare patient. Verify diet restrictions and latex sensitivity. Sanitize hand. Position patient, apply tourniquet, and ask patient to make a fist. Select the vein, release the tourniquet, ask patient to open fist, clean and air dry site. Prepare equipment and put on gloves. Reapply the tourniquet, uncap and insert needle. Ask patient to make a fist, anchor the vein and insert the needle. Establish blood flow, release tourniquet, and ask patient to open fist. Fill syringe, place gauze, remove needle, activate safety feature, and apply pressure. Discard needle, fill tube, and discard the syringe and transfer device. Label the tubes, observe special handling instructions, check patient's arm and apply bandage. Dispose of used and contaminated materials, tank patient, remove gloves, sanitize your hands, and transport the specimen to the lab. Procedure for pediatric venipuncture. Review and accession test requests. Approach, identify, and prepare patient. Verify diet restrictions and latex sensitivity from Guardian. Sanitize your hands. Then you explain the procedure to the child. Be honest with the child and never tell them that what you're about to do wouldn't hurt. Explain to them that it might feel like an ant bite or an insect bite. Then you would ask the patient, parent, or guardian to hold them down or just to give them a gentle hug so that you may be able to perform the venipuncture. And in doing so, you wouldn't have much movement. You can also ask another phlebotomist to assist you in holding the arm so that the child wouldn't pull the arm, causing you to puncture the vein. Establish blood flow, release the tourniquet, fill, remove, and mix tubes in order of draw. Place gauze, remove needle, activate the safety feature, and apply pressure. Discard the collection unit, label the tubes, and apply a bandage to the child's arm. Procedure for fingerstick capillary puncture. Review the test requests, approach, identify, and prepare the patient, verify diet restrictions and latex sensitivity. Sanitize your hands and put on gloves. Position the patient's arm, select the puncture site, and warm the fingers. Clean and air dry the site and prepare equipment. Then puncture site and discard of the lancet. Wipe away the first drop of blood, then fill the mixed tubes. Then fill and mix tubes in order of draw. Place gauze and apply pressure. Label specimen and observe special handling instructions. Check the site to see if it stopped bleeding and apply a bandage. Dispose of used and contaminated materials. Thank the patient. Remove gloves and sanitize hands. Transport the specimen to the laboratory. Procedure for heel stick capillary puncture. Review the test requests. Approach, identify, and prepare the patient. Verify diet restrictions and latex sensitivity. Sanitize hands and put on gloves. Position the patient. Select the puncture site. Warm the site and clean and air dry the site and prepare equipment. Then puncture site and discard of lancet. Wipe away the first drop of blood. Then fill and mix tubes in order of draw. Place gauze and apply pressure. Label specimen and observe special handling instruction. Check the site to see if it stopped bleeding and apply bandage. Dispose of used and contaminated material. Thank the guardian or parent. Remove gloves, sanitize your hands, and transport the specimen to the laboratory. Possible venipuncture problem sites: burns, scars and tattoos, edema, hematoma, mastectomy, also known as the removal of a breast, and damaged veins. Possible patient complication and condition: allergies to equipment and supplies, example latex glove. Excessive bleeding due to aspirin tablets if the patient is using the medication. Fainting or syncope and pain. Steps to follow if a patient starts to faint: release the tourniquet, remove and discard the needle as soon as possible. Apply pressure to the site while having the patient lower their head and elevate their foot, and advise them to breathe in deeply. Talk to the patient, physically support the patient, explain to the patient what happened, and assist them in loosening a tight collar or tie. Apply a cold compress or wet washcloth to the forehead and back of the head. You or someone can stay with the patient until the person has fully recovered. Call first aid personnel if the patient doesn't regain consciousness or does not respond. Document incident according to the facility protocol. References: